Psychosocial and Cultural Care Nursing Fundamentals Questions. Question 1. A client from a different culture avoids eye contact during teaching. What should the nurse do? Option A. Assess the meaning of eye contact in the client's culture. Option B. Assume the client is hiding information. Option C. Demand direct eye contact. Option D. Stop teaching immediately. The correct answer is option A. Assess the meaning of eye contact in the client's culture. Culture shapes communication like a lens shapes light. The nurse assesses meaning before judging behavior. Question 2. A client cries after receiving a new diagnosis. Which response is therapeutic? Option A. This is hard news and I can sit with you. Option B. Do not cry because treatment exists. Option C. At least it is not worse. Option D. I know exactly how you feel. The correct answer is option A. This is hard news and I can sit with you. Therapeutic presence gives emotion a safe place to land. Simple acknowledgement can steady a person when the world feels tilted. Question 3. A nurse is caring for a client who uses traditional remedies. What is the best action? Option A. Ask what remedies are used and check for safety interactions. Option B. Tell the client to stop all traditions. Option C. Ignore remedies unless the provider asks. Option D. Assume natural means harmless. The correct answer is option A. Ask what remedies are used and check for safety interactions. Respect and safety can stand together. Asking about remedies uncovers possible interactions while honoring the patient's lived world. Question 4. A client says, I feel like a burden. Which response is best? Option A. Tell me more about what makes you feel that way. Option B. You should not think like that. Option C. Your family does not feel that way. Option D. Let us change the subject. The correct answer is option A. Tell me more about what makes you feel that way. Open invitation lets hidden distress speak. The nurse does not cover the feeling with quick comfort, but listens for the need beneath it. Question 5. A nurse needs to teach a client who has low health literacy. Which approach is best? Option A. Use plain language and ask for teach back. Option B. Give a long medical handout only. Option C. Use complex terms to build knowledge. Option D. Ask yes or no questions only. The correct answer is option A. Use plain language and ask for teach back. Plain language opens the door. Teach back shows whether the message was received, not merely spoken. Question 6. A client refuses pork-based medication for religious reasons. What should the nurse do? Option A. Notify the provider and seek an acceptable alternative. Option B. Pressure the client because medication is ordered. Option C. Hide the ingredient from the client. Option D. Document non-compliance and move on. The correct answer is option A. Notify the provider and seek an acceptable alternative. Respect for belief is part of safe care. Alternatives protect both treatment goals and the patient's moral ground. Question 7. A nurse uses silence while sitting with an anxious client. Why can silence be therapeutic? Option A. It gives the client space to organize thoughts. Option B. It proves the nurse has no interest. Option C. It ends the conversation quickly. Option D. It prevents emotional expression. The correct answer is option A. It gives the client space to organize thoughts. Silence can be a gentle room where thoughts gather. Used with presence, it invites speech without pushing. Question 8. A newly admitted client speaks limited English. What is the safest communication method for consent teaching? Option A. Use a certified medical interpreter. Option B. Ask a young family member to translate. Option C. Use gestures only. Option D. Speak louder in English. The correct answer is option A. Use a certified medical interpreter. Consent requires clear understanding. A certified interpreter keeps accuracy from being sacrificed to convenience. Question 9. A client becomes angry about a delayed procedure. Which nursing response is best? Option A. I can see this delay is frustrating. Let me find updated information. Option B. Calm down or I will leave. Option C. There is nothing I can do. Option D. Other patients have bigger problems. The correct answer is option A. I can see this delay is frustrating. Let me find updated information. De-escalation begins by naming the feeling without fueling it. Respectful information can turn heat into direction. Question 10. A nurse assesses spiritual needs. Which question is appropriate? Option A. Are there beliefs or practices you want included in your care? Option B. What religion should everyone follow? Option C. Why do you believe that? Option D. Can I change your beliefs? The correct answer is option A. Are there beliefs or practices you want included in your care? Spiritual assessment invites support without judgment. It asks how care can fit the patient's inner life. Question 11. A client with depression says meals have no taste and refuses food. What should the nurse do first? Option A. Assess mood, appetite, weight change, and safety. Option B. Force the client to eat immediately. Option C. Tell the client food is necessary. Option D. Remove the meal tray permanently. The correct answer is option A. Assess mood, appetite, weight change, and safety. Psychosocial distress can affect physical survival. Assessment connects appetite, mood, and safety before choosing interventions. Question 12. A nurse is caring for a client who values family decision-making. What is appropriate? Option A. Ask whom the client wants included in discussions. Option B. Exclude family to protect privacy automatically. Option C. Let family decide without client permission. Option D. Assume all relatives may receive information. The correct answer is option A. Ask whom the client wants included in discussions. Family involvement must follow the patient's wishes. The nurse honors culture while still protecting consent and privacy. Question 13. A client reports feeling panic before a procedure. Which intervention is best initially? Option A. Stay with the client and guide slow breathing. Option B. Leave so the client can calm down. Option C. Give detailed teaching rapidly. Option D. Tell the client fear is unnecessary. The correct answer is option A. Stay with the client and guide slow breathing. Anxiety narrows the mind like a tunnel. Presence and breathing widen that tunnel so learning and coping can return. Question 14. A nurse notices a client wears a protective amulet. What is the best response? Option A. Ask whether it should remain during care if safe. Option B. Remove it without discussion. Option C. Mock it as superstition. Option D. Hide it in a drawer. The correct answer is option A. Ask whether it should remain during care if safe. Objects can carry meaning deeper than metal or cloth. Asking protects dignity and builds trust. Question 15. A client uses a communication board after a stroke. Which action supports psychosocial care? Option A. Allow enough time for responses. Option B. Finish every sentence for the client. Option C. Ask only questions requiring no response. Option D. Avoid conversation. The correct answer is option A. Allow enough time for responses. Communication devices return power to the patient. Patient says the person's voice still matters, even when speech is slower.